they become consumer. Even in government setups, even if it is very low charge, if the charge is for services of the doctors, then they will become consumers. If the charge is not for the service of the doctors, but something like admission or some administrative charges, then they will not be consumers.
Sir, in government hospitals, they will take the OPD paper. So they pay for the OPD paper.
Yeah.
So then they become consumers.
No. That is not the service. That is not a medical service. That is administrative service.
Okay. Okay. So, but this was a charitable hospital.
No, in that charitable hospital, I don't know the specifics of it.
So I think they have not mentioned in the judgment.
Yeah,
so
any of this is met. So maybe even if there is charitable, they may be taking some nominal service charge of the doctors. We don't know. If it is there, then only it will fit there. Otherwise, they will not consider it as a consumer. If it is totally free, then he will know the case will not go to consumer court at all. If it is sustained in consumer court, that means there is some charges levied, at least to some patients, if not for this patient.
Okay. Dr. Gupta, please go.
I agree with that because what happens even in some
Dr. Sinha,
hospitals,
please wait. Dr. Gupta is answering. Please, Dr. Sinha, please.
in some hospitals, for example, even in government hospitals, in our hospital, only one ward used to be a paid ward, and the rest of the 26 wards used to be, free in a government hospital. And even in that case, because that one ward was paid ward, everyone else, all others used to come under the Consumer Protection Act. So as rightly pointed out by Dr. Raichur, if some people in that charitable hospital are paying even in a low amount for this charges, doctor's charges, then all the patients come as the consumers.
So if you read that order carefully, I am fortunate that Dr. Vidya Shetty had sent me that query. That's why I said that I'll wait till everybody finishes. And I read the order completely. And in that order, they specifically said that the patients who get free treatment from the income generated from the paid patients.
Okay.
So, for example, I am running a hospital where I am taking money from the patient, and Dr. Raichur is coming 2 hours a day and is giving free treatment. Okay. I am paying Dr. Raichur or not paying Dr. Raichur is different issue altogether. But I am running the setup, the administrative cost, the nursing charges, the electricity paid, whatever, from the income which I am generating. That is the reason why they are saying that you can afford to give free service because of virtue of getting money from other people. Okay, now that is the approach. My interpretation of this is little different. This is for doctors who are running two activities simultaneously. One as a charitable activity for income tax purpose, and other activity as a profitable purpose. And some money they will divert from paid, profitable business to the charitable business for, income tax purpose. That is very common, and we have seen all this happening around us every now and then. And
So this
personally,
is
I
the
feel there is
question,
nothing
the
wrong.
same setup,
Just a minute. Personally, I don't feel anything wrong in it. If I am managing something legally and saving my income tax, there is nothing wrong in it. But this judgment tells us that you do what you want to do with income tax. We will not consider charitable or free treatment. There is no word of charity in that. The word is free. Now, how I give treatment free is my lookout. I get donation from people, I beg, borrow, steal, whatever. But it should be free. So what I would say is for any doctor who wants to do this even for income tax, there should be two different addresses, two different locations, two different hospitals or two different entities which are not connected with each other. Now in this case what had happened is there is one trust and one hospital. in this one particular case of same doctor couple or same unit. And that is where the court has said that the treatment being given free is from the proceeds of treatment from the paid patient. That is the difference in the judgment. So I hope that is clarifying the issue. Any comments, Dr. Raichur or Dr. Gupta? Any comments, Dr. Vidya Shetty?
Yeah, I agree, sir. I agree fully.
Yeah.
Sir, I understand the concept. That is very simple, that if you want to take money, you take money in one setup. You want to do it free, you do it in a separate setup.
Do it separate setup.
Yeah,
So it
because
is
these,
based-
these were two
clinical
judgments which I
establishment.
saw, sir. One judgment said that since it is free service and service by definition in Consumer Protection Act says that free is not included, you can go for a civil proceeding. But you cannot go to the consumer court because you don't become a consumer. And the second, this judgment was against a charitable. So I was like, there's something new, and this
Yeah.
is a new on 2020, very, very
Yeah,
recent
yeah,
judgment.
very recent, very recent.
So it was really important to understand the aspect, like what is the thinking process that is put into that. Even if the medical services are given free of cost, then the standard has to be maintained is totally agreeable. But still the person becoming a consumer was which I was confused with. So thank you so much. All of you have really cleared out my doubt. I understand that
The
totally.
judges have now
Concept
started
you have put is
understanding.
really clear.
The judges have started understanding business of medicine.
Very true, sir. Very true.
Sir, I personally feel nothing can be free in the world, to be very
True,
honest.
sir. True, sir.
Even if we are filing these court cases, see, I'll tell you, we have started the association, we have got funds from the members. Now we'll generate some money from this course, whatever, 20,000, 30,000 rupees. Okay, which is non-taxable. But still, we have spent huge amount. Court fee was only 10 rupees. Every time I filed appeal or any document, court fee is only 10 rupees. But the Xerox copies we have to take, the postage, 1,000 rupees I am spending postage every time I send documents to Kerala. So nothing is free, right? Even medicine, how can I give free treatment to anybody? I don't know about others, but in first few years of my hospital practice, I conducted 50 free camps for marketing my hospital. Let us call it spade a spade. For marketing. Okay. On 50 alternate Sundays, I had whatever camp was there, everything was free for the patients. I could do it free because from the footfall that was coming into my hospital, I generated practice. I never gave cut to anybody. There was nobody, not a single patient referred to me in last 30 years who has paid money. Whatever is referral is free for referral. Okay. So that is how one builds his practice, right? So I cannot boast and say that I have done free service for people. I mean, what I have done is advertising, marketing expenses. I am very straightforward about it. Okay. I will keep same approach. And if you want for tax gimmicks also, give donation from one hospital to other hospital. That other hospital is free. One hospital gets tax benefit. Other hospital gets your
donation.
No, donations, but legal relief. So that is how one can do it. Okay.
Okay,
Any other
sir.
question on entire session? Any comments? We have worked very hard for bringing all these experts to you for last 12 sessions. 30 experts have come, given their knowledge to you. But still, there can be some lacunae, some loopholes, something deficient. So be very clear. Let me tell us what is deficient. We would like to improve because this is going to be an ongoing activity. Many more people would like to be benefited. So we would like to know how we can improve on this.
So there are many more topics which need to be covered actually.
Please send me the list.
Okay, sir.
You
I
can
will.
tell just now also, if people can add.
Because now ART bill sir has touched. Along with ART, I think surrogacy bill also was a very important.
Okay.
Again, there are certain loopholes in the administration issues where we face day to day, like when we are taking the acts. Can we also have a session where we deal with day-to-day difficulties that the doctors are facing? Because all the medical legal people who are taking knowledge, they would like to help even their colleagues. And they can help only if they have the knowledge. So what are common issues that we encounter, like even, documentation details, what would be important on the legal aspect, how it can be, improved. How do we have, sir, we can only identify problems if they have the vision to where the problems can land the doctors to.
Yes, ma'am. Very true.
So
Very
if we go into a more practical mode, because I can understand there is a time constraint, the speakers have really given their best. This session was really beautiful, sir. I have thoroughly enjoyed every session, and you know how irritating I have been every time. But
Yeah.
I
No,
have
it's
gained
okay.
from it. I
Not
have gained from
irritating.
it.
You have
I
been
am happy
inquisitive,
about the
not
time that I
irritating.
have invested, because I have gained from it.
No, no,
And
we are not saying that you are irritating, you are inquisitive, and that is good. We know that the value of questions is very, others get to learn. There are
exactly.
people who don't want to ask questions.
And
I
so
don't want people to go questions in mind.
And so
Okay.
here, luckily, we are having experts in front of us who can give us the best options and the best answers. Where do we
Absolutely.
search for such educated people around? And we cannot keep disturbing somebody who may be or may not be interested in answering us. So this
Madam,
is one of
I-
a very good platform which we could learn a lot from. And still, there are quite a few topics which came to my mind when we were going through the sessions. Probably I will try to make a list
You
of
make
it.
a list and send it to us. No doubt about we will try and address. One thing which has
the
come
practical
to
aspects if you
yes,
could add on.
yes.
It would
Dr.
really
Raichur, you wanted to say something? Dr. Sinha, you
Yeah.
wanted to say something? Dr. Sinha, please go ahead.
Can you hear me?
Yes, 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 sir.
It has been a overall very nice experience. Then as the medicine is a ongoing developing process, so is the physical complexities. The newer things are coming and going on. So it is a continuous process of learning, I think, and people, those who are interested, should be like the interaction in the group and all by these courses. There can be shorter courses also, like one webinar or something like that for a newer topic or something for the members. Thank you.
Yes, sir. So what
And
probably we
thank
can
you,
also
sir.
do is simultaneously we can have our meetings. We can have one topic for discussion on which people can just discuss whatever they feel, or people can say that I want discussion on this topic and we can discuss. Okay. Dr. Raichur, please go ahead.
Yeah, just I was telling to Vidya madam that about regarding asking questions. I'm a professor, and when I take classes, I encourage students to ask questions. And when they don't ask, I say them that who will be the loser if you have questions but are not asking. So they start asking questions because they recognize that asking question has got a lot of benefits for themselves only. And of course, the other person also gets benefited. So by your questions, we are getting benefited also.
Yes. So
Thank you.
any questions, any comments from anyone else? I'm not going to call one by one. Dr. Surya Prakash, any comments? Dr. Shiva Subramaniam, any comments? Dr. Ramaswamy, Dr.
Yes,
Vadva,
sir.
comments
I-
from you, sir.
In fact, what I do on the end of every topic, the next day I go around to my hospital. I meet one doctors. So I
Okay.
discuss with them relevant topics. They're all enlightened. So they also want to join. So they say when they conduct next course, you tell me we want to join also. So it's very, very informative. They don't even feel, egoistic also, because I'm a non-medical person. So when I go and discuss with all these topics, so they show encouragement. And in fact, they encourage me to do all these things. It's really fantastic, and I'm very thankful to you, sir.
So next time, sir, when the course is declared, you make them join it.
Very
And,
sure, sir. Definitely. Sir.
They will be more interested. When they come live, it will be better.
Oh,
Because
yes.
then it is a personal interaction.
Exactly.
Otherwise, even if you, now I'll tell you the issue with the videos. Everybody asks me that you give me the videos. We want to see the videos. Now I send the videos link to the faculties, taking permission from them to publish it. Only 3 out of 30 faculty members have allowed me to publish. Out of the 3 videos which I published, nobody has downloaded, nobody has seen. Okay, that is the issue, because we don't have time afterwards. We are busy in our practice. The priorities change. Today, Saturday 2:30 is fixed. You will do everything to come to the course and learn.
Yes.
Out of 30 today, we have got only 15 or 16. I can understand everybody has got some other priorities. But otherwise, even if we put a video on, nobody is going to see it. So at least people can come for this meeting. I am willing to give videos to everybody, but my faculty has not permitted. How can I show video of, say, Dr. Raichur? If he doesn't permit me, how can I display the video to anybody else? I cannot do it.
Very
Right.
true.
Now I will send a request once again and try and put all the videos, whosoever permit, I will put. Question answer session I conduct, so I have decided that it is my privilege. I will do it. I have posted. Nobody is seeing it, maybe because they don't like Rajeev Joshi. That is a different issue altogether.
Well, my videos, please distribute, no problem.
No, that is not an issue. I will send you a request. I will send you a link, and then you have to tell me that you can proceed. Because see, this is a medical legal association. I don't want to do anything illegal on the IP that you have on your lecture. Okay.
This
I
is
mean,
an oral consent, sir. I have given consent.
no oral consent is acceptable. I want consent by email.
Okay, sir. As you wish.
Right. Anybody wants to have any comments?
Sir, MPCB Act.
MPCB. Okay. Yes. Dr. Shetty, I will give you one responsibility. Okay. Every 15 days we have a meeting.
Okay, sir.
So about 1 week before that meeting, you send me a topic.
Okay, sir.
Okay. We'll circulate to the people that we are going to discuss on this topic.
Okay, sir.
Okay. And whoever wants to contribute will come for the meeting and listen.
Okay,
And
sir.
the
So
meeting
that's
is
the
meeting
Tuesday
is
one.
every alternate Tuesday, 9 to 10, 8:50 we start. Because certain things people want to discuss before the meeting, but 9 o'clock sharp we start the topics, whatever
Okay.
are in the agenda. So we'll put one topic in the agenda, and whoever wants to come will come. You take the responsibility of suggesting topics, because what happens is we are so much engrossed in various things
Yes.
that we are doing just now. We could think of 36 topics, we could get 36 topics. Now,
Yes.
question is whether we should get additional topics for this course. The course will get prolonged, because I can see for 3 hours also it is very difficult for people to give continuously. I got
Yes.
suggestions saying that make it only 2 lectures every Saturday and half an hour for question answer. But this 36 will go to 18 hours, 18 weeks. If you add some more topics, it will go to 20-24 weeks. So it will become a 6 months program. There are some suggestions saying that we should have 6 months program certified by university. So Dr. Jamkar is working on that, and he probably will get certificate from MUHS. If you done that, then people will get a certificate from university, not from Medical Legal Society. Then people will come for 6 months. I mean, there are people will always weigh what is in their interest and what is not in their interest, right? So we'll go ahead with this.
But our certificate also will get upgraded, no?
This certificate I'll send you by email and possibly
No,
by
sir.
post
If
also.
you get MUHS recognition, then our certificate also will get upgraded. No,
No, you'll have
we
to
are
attend
the
that 6
first
months
batch,
course.
sir.
You are the first batch. Okay. I'll record that suggestion and we'll discuss in the managing committee meeting. But this has to be approved by university.
Yes.
See, my concern at that time will be I don't have any authority. University will be the authority. So I mean, there are different authorities in different places. I cannot hold authority for everyone else or on behalf of everyone else till the
But
time they give
anyways,
to me
it is a very nice.
in writing,
very nice
including Dr.
course.
Raichur's consent for showing his
Showing
video.
video.
So that is how I would like to take it. But I have to thank you, all of you, all the participants and all faculty members for making this program successful. 12 weeks, I did not know how they passed. I have been working for 12 weeks for getting videos down. I have to sit after the program for half an hour to download this. I have to be after the faculty member to send me the presentation. They are busy in their practices, so when last minute they will send me the presentation. I can understand all that, but still it is a, then there are some questions who come to me directly because they in between, they don't want to answer. Some people say that we don't want to ask in the class. I mean, that is everybody's concern have to be taken into consideration, because finally our job is to give knowledge to people. That is the basic agenda. And I thank you all for this participation in this program. We'll go for a photograph, one for last time. All of you, please switch on your videos. Dr. Chauhan, Dr. Megha, Dr. Mahesh Sinha, Dr. Vadwa, Dr. Sayed Haider Ali, Dr. Sandhya Gupta. Smile, please. One. Yes, please, please smile, please. One last time. Dr. Naurange sir, please put on your video. He's connecting now. Just Dr. Naurange sir is there. If anybody wants to ask any questions, we'll have a 5-minute session. Dr. Naurange sir, can you hear me? No, there is some problem with his connection. Okay, we'll go for a photograph. Smile, please. Thank you very much, all of you. Have a nice day. Thank you. Bye.
Thank you, sir. Thank you very much.
Thank you, sir.
Everyone.
Thank you all. Bye. Dr. Devarage sir, can you hear me? Hello.